In my own experience, I've had to go to the doctor before, and whenever I come to a doctor that doesn't seem to actually connect with me on eye level, I don't feel as much trust, and so I just like for patients to know that I'm a person too, and we can just talk about things. And I think that opens up to being able to practice medicine in a better way when we can be open with each other. I grew up in rural Oklahoma with my grandfather who had a lot of heart problems, and there was no cardiologist for literally 200 miles. And I just remember thinking if only there had been a doctor that was available and had the time for us, then perhaps we could have had a little different outcome than we did. I've always been really interested in science, and I graduated with a degree in biology. After that, went to medical school, and so that's very heavily science. Went into residency and was pretty sure I wanted to do cardiology, so did internal medicine, and after that applied for fellowship and became a cardiologist. I really enjoy cardiovascular medicine in particular because, for one thing, I mean, everybody has a heart, and you're most likely to die of heart disease in the United States, so I think that's probably the place where you can make the biggest impact if you can change people's trajectory. That's something that's very satisfying. When I meet a new patient, I always want to, look forward to the future of what would I expect to happen with this person and how can we change their trajectory to a better outcome. I always like to try to get to know them individually and understand, what is your goal? Is your goal weight loss? Is your goal to prevent disease, or is it because your father, brother, and mother all had heart attacks and you're coming up to the age where that happened to them? Those are all things that, I take into consideration and try to come up with a good plan for care. My favorite part of my job is interacting with people. I really like to meet all of the different people that come to me through all the different walks of life and different places in life, and I just like to, have that interaction with people and be able to be a positive influence in their lives in some way. I reflect back and I think about how my grandfather, a lot of different things could have been done for him, and now I see a lot of patients that do remind me of him a lot, and I hear their stories and their family members' stories of what they're going through with their situation, and I can really relate to that. And so it's, I feel like I'm in a better position now that I can help to change those situations for people.